Colleagues, ladies and gentlemen, good afternoon. I'm Dr. Minghui, WHO Assistant Director General for the Communicable Diseases. So it's a great honor for me to moderate the first high-level plenary session for this very important conference. As everybody fully aware, this ministry conference aims to enable great political support and political engagement to celebrate efforts and to end TB across all the sectors, and to form the first United Nations General Assembly high-level meeting on tuberculosis in 2018. WHO, as the leading agency in the United Nations family, we absolutely have a very important role to take the issue forward. So this afternoon session is going to bring a very unique opportunity to show all WHO regions and WHO headquarters how exactly they can do to take immediate actions and steps to continue and intensify the support to the countries to end TB, and also to support the countries and partners based on the result of Moscow Declaration, which are going to be endorsed shortly. And also, in terms of a multisectoral framework, WHO can help the countries with diverse great commitments and action through intensifying the monitoring and reviews mechanism in collaboration with all partners and players. So I'm going to invite the distinguished speakers for this very important session to be on the stage, who are the Minister Veronika from Russia Federation, Dr. Tedros Ghebreyesus, DG of WHO, Dr. Moeti, Regional Directors of African Region, WHO Regional Office, Dr. Carissa, Etienne, who is Director General, Regional Director General for the European regions, Dr. Zsuzsanna, Jakab, I'm making mistakes probably, Dr. Carissa, Etienne, who is Director General for the Emerald regions of for the American region, WHO, and Dr. Zsuzsanna Jakab, who is Director General for the region of Europeans in WHO office, Dr. Swarup, Sarkar, who is the regional director, who is Director for Communicable Disease in the Ministerial, and Dr. Raja Hajia, who is the Director for Communicable Disease in the Emerald, WHO, Dr. Mark Jacobs, who is the Director for the Communicable Disease in the WEPO. So please welcome all the speakers to be on stage with us. Sorry, mistakes I made.
Okay, we can change.
We can change, no, rotation. Okay. I think you should be here, and this is for you. This is for you.
And where are you sitting?
I'm standing. All right, great. So it's probably one of the most distinguished panels for this conference. And now I'm going to invite Minister Dr. Veronika Skvortsova. She is a Minister of Russia Federation. She's also the President of the World Health Assembly for the year 2017 and 2018. So we might have a few questions from floor. That's about how exactly Russia Federation is going to support the WHO to take some action based on the result of this very important conference declaration. And during the coming year, including the WHO governing meetings, including EB and World Health Summit, and at UN high-level meetings. So I'm going to invite the Minister Veronika to speak first.
Спасибо большое, господин модератор,
very much,
глубоко
Mr.
уважаемый
Moderator,
Тедрос,
esteemed,
генеральный директор ВОЗ,
Tedros,
глубоко уважаемые коллеги.
Director General
Прежде всего,
WHO,
позвольте вас
distinguished colleagues,
поблагодарить
first and foremost,
за
let me
особую
express my
атмосферу
deep gratitude for
дружественности,
this
конструктивизма,
special, friendly atmosphere
которая позволила нам
and
в очень
constructive
доброжелательной
approach,
обстановке обсудить
made
очень
it possible
значимые
in a
для
very
всего
friendly
мира
atmosphere to
вопросы,
discuss
касающиеся
very
туберкулеза.
important issues of great concern for
Хотелось
the
бы
whole
с
world
сожалением
regarding
констатировать,
TB.
что
Regretfully, we have
время
to
нашей конференции
state
уходит.
the
Мы
fact
подошли
that
к
the
нашей
time
итоговой
is,
пленарной сессии заключительной, и
time
вместе с
flies,
тем
and
количество
we're about
вопросов,
to close this
которые
conference,
мы могли бы
and,
обсуждать вместе,
the number of
оно
issues that we could
продолжает
have discussed
увеличиваться,
together
и
is
возникает
actually
пожелание сделать
getting,
наши
more
встречи
numerous,
регулярными,
and
для того,
we
чтобы
shall
мы могли
certainly
обсуждать
would be able to see
все
to them
животрепещущие
during our
вопросы
regular
касательно
future
темы
meetings,
туберкулеза
when we could
и
also,
других инфекционных
revisit
заболеваний.
all these issues related to TB and other
Наше
communicable
совещание
diseases.
посвящено подведению итогов конференции, которые одновременно являются идеологическим и профессиональным базисом, на котором строим мы свои планы по ликвидации туберкулеза как в страновом, так и глобальном контекстах. И, конечно, мы рассчитываем на то, что эта платформа явится основой для формирования позиции мирового сообщества к заседанию высокого уровня Генеральной Ассамблеи ООН, которая будет проходить в 2018 году. Что мы вынесли после обсуждений на наших пленарных и круглых столах, всех совещаниях, которые проходили на конференции? Прежде всего, что несмотря на принимаемые меры как на страновом, на региональном и на глобальном уровне, проблема туберкулеза остается чрезвычайно актуальной. Более того, туберкулез мультирезистентный, туберкулез, ассоциированный с ВИЧ-инфекцией, продолжает наступать. В связи с этим на обсуждениях были поставлены ключевые задачи. Безусловно, обеспечить доступность медицинской помощи и социальной поддержки больных туберкулезом, обеспечить стабильное и достаточное финансирование противотуберкулезных мероприятий, а также существенно активизировать прорывные научные исследования, направленные на создание всего спектра необходимых тест-систем для ускоренной диагностики лекарственной чувствительности, эффективных лекарственных препаратов, коротких режимов химиотерапии, новых эффективных вакцин. Уважаемые коллеги, хотелось бы сконцентрировать внимание на формировании многосекторального видения проблемы туберкулеза и создании многосекторальной системы подотчетности. Известно, что туберкулез социально значимое заболевание, но оно до сих пор позиционируется в основном как заболевание в подотчетности Министерств здравоохранения стран. И игнорируется социальная обусловленность этого заболевания, в том числе необходимость подключения к решению проблем туберкулеза, ведомств, отвечающих за условия жизни и труда, экологию, климат, образование, финансы, экономику и других. И, по сути дела, Министерство здравоохранения любой страны сталкивается с туберкулезом тогда, когда человек уже инфицирован. как минимум на латентной стадии заболевания. Чрезвычайно важно подключить все сектора экономики и хозяйства любой страны для того, чтобы можно было препятствовать возникновению туберкулеза. Вот в свете сказанного, создание многосекторальной системы подотчетности, когда мы можем визуализировать вклад любого ведомства, экономического, общественного и здравоохранного в решении проблемы туберкулеза на основе понятных и прозрачных индикаторов является чрезвычайно важной задачей, как в национальном контексте, так и на глобальном уровне. И это становится насущной необходимостью. Мы считаем, что эта приоритетная работа должна быть безотлагательно организована при координирующем влиянии Всемирной организации здравоохранения с вовлечением всех заинтересованных сторон. И представлена должна быть руководящими органами ВОЗ и на заседании Генеральной Ассамблеи ООН. В России работает, ведется уже 3 года. У нас разработана национальная система мониторинга ключевых сигнальных показателей, эффективности реализации планов, связанных с ликвидацией туберкулеза. Мы создали межведомственные комиссии, и система уже сейчас приносит пользу, хотя она постоянно совершенствуется, и мы планируем в большей степени вовлекать в систему другие сектора экономики. Россия готова подключиться к этой комплексной работе под руководством Всемирной организации здравоохранения. Конечно, дорогие коллеги, хотелось бы сказать, что разобщенность никогда не способствует прогрессу. И залогом успеха в любом большом деле является сотрудничество между странами и наша координация действий. И 70 лет назад Всемирная организация здравоохранения была создана как раз для формирования глобальной идеологии в сфере охраны здоровья людей, проведения координации деятельности на национальном и региональном уровне, а также перевода этой идеологии и внедрения этой идеологии в другие сектора и на высший уровень политической власти. Поэтому я бы хотела закончить тем, что пожелать нашей организации, Всемирной организации здравоохранения, лидеру этой организации, доктору Тедросу и всем нам эффективной и совместной работы для победы над туберкулезом, для выполнения целей устойчивого развития. Организация Объединенных Наций, Россия во всех процессах будет принимать участие, в том числе активное участие в подготовке встречи высокого уровня Генеральной Ассамблеи ООН. Спасибо большое.
Thank you, Minister Veronika. I think you absolutely highlights a few very important points, which is one, probably the major items in this Moscow declaration for this conference, that is multisectoral accountability framework. I think that's absolutely very issue, how exactly we can look at the country's progress and achieve to the target of ending TB. Now I'm going to give the floor to every regional directors and the distinguished representative from every regional office of WHO. And Dr. T.D. Moeti, she's a regional director of African region. And so maybe question might be similar with all the distinguished representatives sitting here representing the region office. Now how exactly you can take the leading role to help your country in your region to commit, to support the commitment and the programs about ending TB, and how could you work with the country to mobilize strong interest and high-level participants for the UNGA in year 2018? Moeti?
Thank you very much, Ren. Honorable Ministers, Director General, colleagues from other UN agencies and regional bodies, and partners in non-governmental organizations, academia, philanthropic foundations, and the private sector. Ladies and gentlemen, this has truly been a very stimulating and motivating meeting, conference. First, I'd like to say that the African region has made significant progress in the fight against tuberculosis over the years as a result of commitments already made by the national governments and the support that they've received from international partners. We have halted at the regional level and started to decrease TB incidence, and most countries are experiencing significant declines in TB notifications, incidents, and deaths. However, we have acknowledged during the discussions at this meeting that there are still gaps in the response and much still to be done. Our TB incidence rates in the region are still the highest, and the current rate of decline of TB incidence lags behind the level that we need to achieve to end the epidemic by 2030. And 16 of the 30 global TB high-burden countries are in the African region. The collaboration with the private sector, which has been discussed at this meeting, also needs to grow, as does engaging communities for their contribution and their taking charge of their own health. And critically, domestic financing for TB control interventions is still far from adequate in many of the countries in our region. However, there is considerable reason for optimism, particularly following our discussions here. I'm so very encouraged by the determination to mobilize commitment shown by the Ministers of Health of the African region, facilitated by the African Union Commission, particularly at the side event that was organized early this morning. The African countries are coming up with a common African position towards the high-level meeting at the UN General Assembly next year, a golden opportunity to build consensus on what we as a region, as a continent, are intending to do to end TB in the African region by the year 2030. I'm also deeply encouraged and inspired by the determination of African politicians as represented by the parliamentarians that have been with us at this meeting and those who have not been here, who are taking their advocacy and accountability responsibilities very seriously, not least through the TB caucus movement, to mobilize political leadership for TB control in the countries and to see it translated into resources, action, and results. WHO is committed to accelerating and supporting the efforts of all the member states in the African region to realize the desired result of ending the TB epidemic by 2030. In particular, we are committing to working with our member states and partners, first to sustain and increase the advocacy and leverage our partnerships for TB control commitment and leadership, including at the highest political level in our countries and in the region. To provide the technical support for program implementation, including the health system strengthening, capacity building, innovation, linking TB response to our work on universal health coverage, which we've already started in the region, driving integration, working with communities, and covering some of the gaps that I've identified previously in the countries. We have developed in the African region a framework for universal health coverage, and actually next week we'll be convening in Brazzaville the leaders of the work in countries on health system strengthening, together with some of the other programs, including some TB program leaders in Brazzaville, to commit to that framework. I will ensure that the results of this meeting are discussed at the meeting next week, and ensure that we focus on how to deepen the accountabilities, how to sensitize those people who are leading universal health coverage interventions in the countries to take TB into account. In order to make sure that these actions are implemented, we will also support the development or strengthening of robust monitoring and accountability systems that will enable the countries to monitor progress towards the set targets. And this includes, again, within the universal health coverage framework, multisectoral accountability systems that we need to develop with our other partners. We have a partnership at the regional level called the Harmonization for Health in Africa, in which we work with other agencies, including those who work in other sectors, and we will incorporate this work on tuberculosis in our discussions and our work with our partners, which include the African Development Bank. As for the common position and the content of the Moscow Declaration, which is going to emerge from this meeting, we will ensure that in our caucus at the next World Health Assembly, we discuss this document so as to remind the ministers and further solicit their commitment to mobilizing in their countries for adoption of this and for promotion of participation in the UNGA. We will also approach the regional economic communities with whom we work on health and promote this work at their level during the next year. And we will organize at the next regional committee, which happens in August next year, a session or a side event on this tuberculosis movement that will be just before the UNGA next year. So as a regional director for Africa, I commit to supporting promotion and advocacy for strong participation in the UNGA by the member states, and after that, most importantly, to supporting implementation of the declaration that will emerge from that meeting, which I imagine will be strongly aligned to the common position that the African countries are working on at the moment. I thank you very much for your attention.
Thank you, Dr. Moeti. I think your statements also touch upon another very important issue, how exactly integrate TB so prevention and control programs into the health system, strengthening the efforts in the regional levels. To me, it's absolutely very important. And also, you mentioned, under your leadership, working with partnership with all the partners in the region, they absolutely can play very important and contribution to the target of ending TB. And so, thank you very much. I understand we might expect more high-level political leaders from your region for the UNGA in the year 2018. So I'm going to give the floor to Dr. Carissa Etienne, who is regional director for WHO office for the Americans. So question might be similar. I think if you look at the maps of Americans, probably TB burden is not really big as other regions, but I understand actually ending TB is a global target. So based on your capacity as regional director, how could you work in your capacity to work with your regions, with your countries and other partners globally on these very important issues? And how could you generate the interest and political interest as well to have a high-level discussion in New York? So Carissa?
Thank you. Good afternoon. Minister of Health of the Russian Federation, the Honorable Veronika Skvortsova, DG of the WHO, Tedros, my fellow WHO regional directors, esteemed ministers, partners, representatives, and delegates. I bring you greetings from the Pan American Health Organization, which is the American Regional Office for WHO. And let me begin by expressing our deep appreciation for the excellent leadership that has been shown by the government of the Federation, of Russian Federation, but also for the openness that we have seen from all of our participants, and particularly member states who've shared their experiences with elimination, their experiences struggling on a daily basis towards the control of tuberculosis. And I think that we've learned many lessons in this meeting. I take this opportunity also to make the point that this level of commitment that we've seen at this meeting leading up to the declaration is actually a very good way towards ensuring that we have a very participative but very effective high-level meeting at the UN General Assembly. I want to share with you just a few a brief situation of TB and tuberculosis in the Americas. As you would know, we achieved the Millennium Development targets related to TB ahead of the schedule. But this is the good news, and we are rightly proud of it. But despite what is our relative success, we in the Americas, we do face a difficult challenge. I know you think that our prevalence rate and incidence is low, but even as we address tuberculosis and addressing the challenge of leaving no one behind, as with many other public health problems, our underlying issue is the serious social and economic challenges that persist in our region, particularly inequity. We see inequity in terms of social exclusion, inequity particularly as it relates to poverty, crowded living conditions, co-infections, comorbidities, and for many of the health problems that our countries in the Americas must deal with, the underlying issue is inequity and lack of access to the social determinants of health. And I want to put it to you too, that in many of your countries, this is the underlying problem that ensures that TB is persisting. We believe that all of these problems are magnified in people who live in conditions of vulnerability, such as people living on the streets, people deprived of liberty, substance abusers, indigenous populations, and children. And we recognize that to address this issue, we must address the access to the social determinants of health. And this is a major challenge for us, and it is an issue that we have addressed in our strategic plan, and all of our member states are engaged in addressing those social determinants of health. And in particular, this requires that we must engage in multisectoral approaches, and importantly, including civil society and the private sector within this multisectoral movement. The second thing that we must realize is we can't have a health system for TB and a health system for malaria and a health system for NCD. We must move to build strong, resilient health systems. But at the same time, we need strong disease programs. And it is the intersection of strong TB programs with a strong, resilient health system that is going to ensure that we can address adequately and effectively the TB situation. Yes, we need access to care. We need access to health services. We need access that does not lead to financial catastrophe. We need healthcare workers that are well prepared and are able to deliver. We need community workers and community health aides to be involved. We need people who will go out into the communities, who will meet the people, who will identify possibly patients with tuberculosis. And we need the people who would bring them into care. All of this is part of what a resilient health system is. And without that, we face difficulty. We need access to technology, access to diagnostics, access to treatment and the drugs that are required for the various stages of tuberculosis. But this access must be available to all peoples, not just to a few, but to all, particularly those who cannot afford it. And access to those medicines should not lead to impoverishment. I believe, however, that it is well recognized that we need increased domestic investments for health. But 2 weeks ago, we were at the NCD meeting, and we were telling governments that it was important to invest in NCDs. Today we are here, and we are telling governments it is important to invest in TB treatment and prevention programs. And tomorrow we will say malaria is important, and HIV is important. What is required of us as I think as WHO, as co-partners in health, and this is particularly what we are doing in the region of the Americas, how do we work with governments to help them best identify their priorities, and within those priorities to define the care that will be received by the population at the various levels of the health system. If we don't do that, I fear that our governments will become really very, very tired. They will not know how to invest and where to invest, because each one of us is putting a certain level of pressure on them and saying it is imperative, it's imperative that you invest in each of those. And so here I am now with a plea to say, how do we come together across the health spectrum to better work with governments to help them to define their priorities that are relevant to their own needs and their own health situation? And for me, that's going to be very important. I also wish to share with you that in our 115 years as an organization, we have an impressive history of elimination of diseases. And we have an elimination agenda, and tuberculosis is part of that elimination agenda. At the moment, we are developing the plan with our member states as to how we are going to attempt the elimination of many neglected tropical diseases, tuberculosis, etc. And it will be building on the experience that we've had as a region in the elimination of diseases. We do have a plan of action for the management of tuberculosis, 2014 to 2019. And we hope that as a region that we will meet the elimination agenda long before 2025 or 2030. Let me say that if we are to sustain the momentum, we have to keep building and ensuring the quality services for TB, for HIV, malaria, neglected tropical diseases, emerging diseases, communicable diseases, and non-communicable diseases. I fear we do not live in a world with a single disease. We live in a world where people and one individual can have many health issues and health problems. So I do feel that this conference is a step in the right direction. At the NCD meeting in Montevideo, Uruguay, I ended by saying that these meetings, including UN General Assembly meetings, are vital. They are very important for moving the political advocacy and for ensuring that governments invest in health. But the most important thing is action at the country level, action at the community level, action in the communities that live in vulnerable conditions. That's where the people get infected with tuberculosis, that's where they live, and that's where they die. And so without the necessary country action, we will be here speaking over and over again. And I do hope that the declaration that will be adopted at this meeting leads us to a place where we can recommit, all of us, to ensuring that we address this age-old problem of tuberculosis, and that together we can bring it to an end. And this is what the region of the Americas, the Pan American Health Organization, this is what we commit to. And I personally commit to ensuring that we can end tuberculosis in the Americas, and that we will engage with all of our member states to ensure participation at the UN General Assembly. Thank you for this opportunity, and thank you for all of your experiences. Thanks.
Thank you, Carissa. I hear your commitment and accountability for the issues taken forward. I hear strongly, probably American region will be first region in WHO office to end TB. I hope this became true under your leadership. Okay, good. All right, so I'm going to give the floor to Zsuzsanna, who's the regional director for the WHO office for Europe. So, Zsuzsanna, you hear the strong commitment and the leadership from Russia and maybe the other country in your region. So how could you, give more support under the leadership of yourself and your staff and to take the issue forward? I understand actually that many countries actually still have a lot of issues, not only about TB, probably other public health issues. But how could you manage and to take the whole public health problems into one coordinated and systems approach to address? Zsuzsanna.
Well, thank you very much for giving me the floor. Ladies and gentlemen, this conference is drawing to an end, and this has been really, truly enlightening. And what I feel is that the resulting actions have the full potential to be a game changer, especially if we take integrated approaches, integrated with health systems, primary health care, and also integrated approaches looking at the root causes of the tuberculosis, and particularly the social determinants of health and inequities. The Moscow Declaration, which will be presented at the next session, is very timely. This is a great momentum which leads us to the UN General Assembly in 2018 and the high-level meeting there, and we need to collectively embrace the declaration that comes out of this conference. And I would like to commit on behalf of Europe that we will take the 4 elements, the 4 key strategic directions of the declaration forward. We integrate them into the action plan that is already being implemented in the European region. As I told you yesterday in my opening speech, the European region has made good progress in TB elimination, but we have a number of challenges, and in order to respond to these challenges, the declaration will be absolutely key and vital for us. And I'm also happy to tell you that we will work together with the European countries to be very well prepared for the UN high-level meeting, and also to come with a concerted effort to give full support to the declaration and also to take it forward through political commitments. Now, more concretely on the 4 elements of the declaration, what I would like to highlight is that we need to revamp the political commitment for immediate and bold actions. And not only another call for actions, as Dr. Tedros mentioned it yesterday, but we also need to ensure concrete actions at all levels. Concrete actions that lead to tangible and immediate results to save the lives and change lives of the people who are affected. It is not enough to walk towards ending the TB, as in this way we would arrive too late for far too many people. We need to leap forward with engaging all the sectors. Intersectoral approach is absolutely key, involving those who are involved in addressing the antimicrobial resistance, and work under the leadership of the highest political level for a truly whole-of-government approach. As well as we have to actively enable and work together with the civil society organizations, patients and communities for a whole-of-society approach. We shall also address the root causes, as I mentioned earlier, particularly the social determinants of health. And for this reason, in our region, during the recent regional committee, we asked the member states to adopt a European roadmap for the SDG implementation, which links disease prevention and public health issues partly to health systems, but also more broadly to the various determinants of health. This will also address the MDG unfinished agenda, including ending TB and leaving no one behind. And talking about leaving no one behind, let us not forget our dearest, the most important investments, who are our children. And in this regard, it is very important to improve childhood TB prevention and care, and equally important to instill our children with essential values such as equity, ethics, and human rights to ensure better health and well-being for all people and nations alike. Then secondly, political commitment also has to be translated to increase resources, and all the previous speakers addressed this issue. We have to ensure sufficient and sustainable financing, both domestic funding as well as external support for the countries that are in need. And in the European region, we have to continue the negotiations, both with the external partners, but also with the countries who are graduating from the Global Fund funding. and reach out to high levels to ensure that the global fund funding is replaced by domestic funding, and that needs to be very high on the political agenda. We cannot afford not to have sufficient funding for those countries who are most in need. So investment is a key issue here, and therefore when we reach out to political leaders, we also have to make the point that investing into tuberculosis, investing into disease prevention and control, investing into public health is an investment for the economy and not a cost and not an expenditure. Thirdly, there is a dire need to develop new tools to diagnose and treat people as close as where they live and work. Therefore, we need to speed up research and innovation and make sure there is a full access to the new tools for all. And building on the Moscow Declaration, we need to revive international collaboration and explore global, regional, and interregional platforms for research and development with very concrete milestones. And then finally, Mr. Chair, I would like to come to the issue of accountability at all levels. To this end, the Moscow Declaration to end TB calls for shared responsibility for action. This will be supported by a carefully developed accountability framework to assess implementation regularly and oversee that our actions are leading to impact. From the WHO side, and in line with our reform, we shall also take into account the new general program of work of WHO to support countries to achieve universal health coverage through people-centered care with a strong public health approach addressing co-infections like HIV, viral hepatitis, but also provide integrated social and health care. And this accountability will be very high on our agenda. So when we move forward with the countries to the implementation of the action plan, we always build in a monitoring system to account for the actions. So in conclusion, Mr. Chair, we would like to have a call for 3 C's. And the 3 C's mean commitment, cooperation, and coordination, collaboration for full implementation of the Moscow Declaration to make our dream become a reality to end TB, and to make sure that this conference and the declaration really becomes a game changer. And from the European Regional Office perspective, you can count on our full support and continued leadership with our partners in the European region to support our member states. Thank you very much.
Thank you very much, Zsuzsanna. I hear your strong commitment and also very nice understanding what that means, political commitment, and how you can translate political commitment into the action, which is domestic investment on TB and health issues. That's absolutely could be one of the testament to value what that means, the accountability framework in the country levels. Now I'm going to give the floor to Dr. Swarup Sarkar, who is Director for the community disease in the WHO office for the Southeast Asia, which is the region have, unfortunately, almost half of the global burden of TB. So now I'm very happy to hear what's like your commitment and what you're going to do as a senior representative for this conference in your regional office to work with the member states to support the country. And I hear actually many asked from your regional member states would like to WHO to do this and that. How would you do that? Dr. Swarup.
Thank you. Honorable Minister, Honorable Ministers, Your Excellencies, DG Dr. Tedros, distinguished delegates, friends and colleagues, good afternoon. I bring greetings from our Regional Director, Dr. Poonam Khetrapal Singh, and also some of the member states who could not be present here today. This meeting I see on behalf of people of our region as a historic meeting. We see this meeting as a place of shared responsibility and solidarity because in our region we suffer due to half of the world disease burden. In our region, we don't not only suffer from the disease due to absolute numbers, we also suffer from the disease in a disproportionate fashion. Home to 1/4 of the global population, we account for half of the global new infection. We often account for a large number of multiple drug-resistant tuberculosis. In our region, still, poorer people suffer more, in some of the studies 5 times more than the other income group due to tuberculosis. It's one of the causes of impoverization due to treatment in our region. Now, it is very clear that unless we end TB in the region of Southeast Asia, CRO, we can't defeat TB in the world. Now, defeating this disease needs leadership. And I'll now answer the question how we are demonstrating leadership in our region. Our regional director, Dr. Poonam Khetrapal Singh, declared this Ending TB as her own flagship program 8 months back. And when this meeting was not even planned, she, with the host country, Government of India, called a regional meeting, and it led to declaration of all the ministers of the region to end TB in time. One of the decisions which was taken in that time was to participate strongly and heavily and with full strength in the UN General Assembly for mobilizing global support and the resources. And in this leadership, we also published something we call Bending the Curve, in which we clearly recognized that at our current effort of reduction of disease incidence, unless we bend the curve fast, we do a fast-track approach, we cannot end TB in time. Our ministers, in their ministerial declaration, asked for 5 things. And as DG pointed out on the first day itself, that this meeting did not end in a call for action. The ministers and the leaders of our region started walking their talk. I'll give you evidence for that. You have seen and you have heard the Minister of India, who within 1 year has increased the domestic funding by 3 times, from $200 million to $600 million US dollar, a spectacular rise after the declaration, a very successful example for all of the world. We also see the Maldives, which is one of the lowest incidence country in our region, immediately came out for a very aggressive elimination plan. We have seen Indonesia to come out with the rapid expansion of Gene Expert following the call for action. We also have seen Bhutan to take this up to the Prime Minister's leadership. So our DG, Dr. Tedros, we assure you that we did not end up in a declaration which ended in itself. We are showing results. Also, one of the important components in our declaration was need for investment on research and innovation. The modeling work from our region showed that unless we change our strategy from a passive case diagnosis to active case diagnosis, we cannot reduce the disease substantially. It needs implementation research. We don't need only money for, the whole world doesn't only need money for program, it also needs money for implementation research, how to make an active case diagnosis strategy operational and successful. We also need money for innovation, and investment of innovation is key to end TB. Unless we manage, our modeling shows that the last 20 to 30% of the reduction of new infection, the last mile program would not be achieved unless we have tools and new approaches to address latent TB infection. So without investing on research, innovation, we can't end tuberculosis. So in this effort, our regional director, our regional office WHO is fully committed to support the aspiration and the ambitions from some of our member states and many of our member states to work with other South countries to help them in commodities for sharing generic medicine and the results of innovation and new commodity research. In our region, we have the best example of universal health coverage, Thailand and Sri Lanka, who are showing that you need not be rich, but you could still afford very high level of universal health coverage, and they are showing newer methods of integration of disease-specific targeting within a universal health coverage. WHO CRO with its member states are committed today to transform the region from being an epicenter of the epidemic or the disease to a place of healing for its own people, and for a solace for the most of the people outside this region and rest of the world through sharing of its commodity, science, and knowledge. And thank you very much.
Thank you very much, Swarup. So we're expecting the more good story and successful story from your region in the UN high-level meetings of next year. So I'm going to invite Dr. Rana Haji. She's the Director for the Communicable Disease in the WHO Eastern Mediterranean Office. So what's your exactly commitment you're going to say, representing your acting regional director about these very important issues?
Okay, thank you very much, Ren. Honorable Minister, Dr. Tedros, my dear regional directors, dear colleagues, ladies and gentlemen, it is my honor today really to be with you all at this historic meeting. I cannot describe this, but a historical meeting with a really important commitment that's being made. It's my pleasure to report to you today, though, on our progress in the region, in the Eastern Mediterranean region, and on some challenges, but our full commitment to support our member states to achieve the end-TB strategy and the SDGs and to implement the Moscow TB Declaration. Our main focus remains on improving early detection and treatment of TB, including drug-resistant TB, and to ensure high-level political commitment, adequate financing, and accountability. One of the key challenges in our region is to improve the rate of case detection. Our region represents only about 7% of the global burden of new TB cases, but last year in 2016, we were able to detect only about 68% of the estimated total of 766,000 cases in our region. But we have a very ambitious goal, actually, even before 2030. We would like to reach 90% detection by 2020. And what we are doing is the following. So far, in terms of achievements, once we detect the cases, even though we have a hard time getting screening, our patients are very well taken care of, and our region has achieved a treatment success rate as high as 91% that we would like to maintain. And this was mainly done by integrating TB care in primary health care. As a result, TB mortality rate in our region decreased significantly. Between 2000 and 2016, the mortality rate in our region dropped by almost 2/3, from 32 to 12 per 100,000. Only 4% of all TB cases in our region are drug-resistant, but ensuring access and continuation to treatment for these patients is among our top priorities, which also fits well with our efforts to fight antimicrobial resistance in the region, another priority for us. In addition to improving detection, we have pushed for a major increase in laboratories that are using new rapid diagnostic techniques, such as GeneXpert and others, more than doubling in 1 year from 126 laboratories in 2015 to 293 laboratories in 2016. In terms of political commitment, you have heard yesterday from Her Excellency, the Federal Minister of Health of Pakistan, which represents a major part of disease burden in our region, about real political commitment and their actions and efforts to control TB. I cannot talk about our region without addressing one of our major challenges, which is the complex emergencies. And this is representing a big challenge for us for access to various health interventions, including TB interventions, and is going to require special global attention. For example, we have countries in the region that used to have very low burden of TB, such as Lebanon and Jordan and Libya, that now have to deal with thousands of new cases of TB each year, representing more than doubling of disease incidence in their own countries. And this has put significant strain on health systems in these countries, and they are also facing major difficulties in ensuring an adequate supply of drugs, in particular second-line therapy. The Eastern Mediterranean Region Office, though, has developed a 5-year regional strategic plan, 2016 and 2020, to start the process of ending TB in our region, which was based on the global end-TB strategy, and it takes into account countries and complex emergencies in our region. This plan was endorsed just last October by all ministers of health in our region during our last regional committee in October in Pakistan. Also, in preparation for the UNGA, we will plan to have a high-level meeting to ensure that our countries discuss also the TB declaration and are fully prepared to support it at the UNGA. We are confident that with the high commitment that we have at the national level, our full commitment at the regional office to support our countries, we will be able to improve the detection rate and treatment, as well as prevention efforts to reach these targets that we set for 2020, as well as the targets for NTB and SDGs by 2030 and 2035, and the Moscow TB Declaration. We will work closely with our countries and all our partners, including civil society, to ensure adequate financing and accountability to measure the impact of our interventions, to develop the mechanisms to monitor progress, and to be able to act based on the results. We look forward to the endorsement of the Moscow TB Declaration, and with this renewed commitment to roll up our sleeves and to move ahead fully with implementation to prepare for strong participation at the UNGA. Ren, if you allow me, I just wanted to add a very brief personal note. Actually, I was sitting here yesterday afternoon listening very carefully to the patients who were speaking, to the advocates, to the civil societies, and I just couldn't but feel the burden of the responsibility they're putting on us, looking up to us to actually get rid of this major disease that has plagued humanity for ages. And I would just like to pledge to them and to promise them that we will all work together and to do our best to be up to the expectations to get rid of this disease and to decrease human suffering and save lives. Thank you very much for your attention.
Thank you, Rana. I think probably we share same commitment and pledge to civil society, who is absolutely people we're supposed to serve. And I'm going to invite Dr. Mark Jakab, who's Director for the Communicable Disease in the Western Pacific Region, WHO Office. So, Mark, and I understand actually in your region, you might have a few countries also on the top list of a high TB burden, unfortunately. So how could you work with the country in your region's capacity to support them and to generate this political interest and commitment and financial support to the people and to invite them to the high-level meeting in New York?
Thank you. Honourable Ministers, DG Dr. Tedros, RDs, colleagues, ladies and gentlemen, good afternoon. The Western Pacific region, which is home to about 17% of global new TB cases in 2016, has made substantial progress in TB care and prevention in recent years. TB deaths have reduced by 62%, new cases by 29% compared to 2000 levels. Over 2/3 of the estimated new TB cases are started on treatment, and in 90% of those, treatment is successful. The countries in the region are also making efforts to find the as yet undetected cases. And almost all high-burden countries in the region have adopted newer tools and drugs, as well as shorter regimens for drug-resistant TB. But despite that important progress, the burden of TB still remains high, particularly in the 5 countries where over 90% of the regional TB cases occur. As in other parts of the world, TB also disproportionately affects vulnerable populations. And there's growing concern, again, as in other parts of the world, about the burden and spread of drug-resistant TB and the large gaps between the numbers of estimated drug-resistant TB cases and the numbers of cases that are currently diagnosed and treated. Improving the evidence we have of the extent of these remaining challenges and linking that evidence to strengthened action has actually been a particular priority in recent years in the Western Pacific. For example, 6 priority countries in the region have recently conducted TB prevalence surveys, many doing repeat surveys to monitor the impact of TB control. And those prevalence estimates have been revised significantly upward in 3 of the countries. And that, of course, it makes it clear that we already knew there was the need for substantial scale-up of case finding, diagnosis and treatment, but now we actually know that it's even more substantial scale-up that's needed in those countries. Another important example of the emphasis on information for action is the drug-resistant TB survey that was recently undertaken in Papua New Guinea, which reported particular hotspots in the country of MDR-TB, and there was an especially high rate of MDR-TB in one large provincial community where nearly 1/3 of the total TB cases were found to be MDR-TB. And there was also in that community evidence of intense community transmission, as about half of the MDR-TB cases were new cases. So that finding led to action, with government declaring an emergency relating to that situation, and with support from key partners, the response to TB in the community was accelerated, and it's had a measurable impact already. There's improved case detection, and there's a reduced loss to follow-up to almost 0, but still a lot of work to be done. 4 of the 5 high-burden countries have also undertaken surveys to ascertain the baseline for catastrophic costs to TB patients in their households. Finding that between 1/3 and 1/2 of TB patients currently face catastrophic costs due to the disease, those countries have now started designing policies and interventions to address this. At a broader level, countries are also implementing the Western Pacific region Regional Framework of Action 2016 to 2020 in line with the NTB strategy. In addition, at the recent Regional Committee meeting in October, it was endorsed the Regional Framework for Action on transitioning to integrated financing of priority public health services. So that provides guidance on achieving increased and sustainable financing for key public health functions, including TB care and prevention. And in fact, the TB program was a core part of the development of that whole broader agenda item. And of course, the work on achieving increased and sustainable financing is particularly important in the context of the need to reduce reliance on external funding as donor priorities change. WHO in the Western Pacific remains committed to support countries to achieve global and regional TB goals and targets, including, of course, the outcomes agreed at this important meeting and also at next year's high-level meeting. Through policy guidance, through technical assistance, through monitoring and surveillance, through research and through advocacy. And we'll especially support countries in their efforts to transition to integrated service delivery and financing, and to also address MDR-TB within the context of the AMR and health security agendas. We're confident that together we can in fact end TB. Thank you.
Thank you, Mark. Now it's my honor to introduce a short video remarks provided by the Honorable Miroslav, who is the Minister of Foreign Affairs of Slovakia, and he's also the current President of the United Nations General Assembly. Will absolutely going to oversee the in the United Nations General Assembly high-level meeting on TB for the year 2018. So I'm going to have the video, but I have to give you a little bit of a heads up because the video was provided only in English, and I hope the interpreter can help us for other UN languages. WHO going to put on the website with other UN languages in the subtitles. So let's read this, where's the video's remarks?
Excellencies, ladies and gentlemen, I'm pleased to address this first global ministerial conference on tuberculosis. And I'm sorry that my schedule did not allow me to be present with you in Moscow. I want to congratulate the WHO and the Russian Federation for convening this conference. It addresses a pressing issue of global concern, and it helps us to prepare for the next year's high-level meeting of the General Assembly on the fight against tuberculosis. I'd like to take this opportunity to stress two key points today. The first is that more action is urgently needed to fight tuberculosis. Tuberculosis is the top cause of death among infectious diseases, yet it receives little visibility. Tuberculosis is a treatable and curable disease, yet around half of the cases are undiagnosed. In 2016, 1.7 million people died from the disease. 2 years ago, we collectively agreed to end the epidemic of tuberculosis by 2030 as part of the Sustainable Development Goals. Through the WHO strategy End Tuberculosis, we are aiming for a 90% reduction in tuberculosis death and an 80% reduction in the tuberculosis incidence rate by 2030. But the pace of progress has been too slow. Countries need to move much faster to prevent, detect, and treat tuberculosis if the targets are to be achieved in the next 15 years. We need to do more to raise awareness about this public health challenge and to mobilize resources. I echo your calls for rapid progress towards universal health coverage and sustainable financing. We need action on the determinants of tuberculosis and greater investment in research and innovation. Many people mistakenly think of tuberculosis as a disease of the past. Quite to the contrary, tuberculosis is a top killer today. And this brings me to my second point, which is that the high-level meeting of the General Assembly will present a critical opportunity. It will allow us to galvanize global action and innovative collaboration towards ending tuberculosis. Let us not travel to New York only to say we convened the meeting. Instead, let us work towards an outcome that yields meaningful results for people all across the world. I'm pleased to learn of the many stakeholders participating in your conference in Moscow. I hope we can build on this multi-stakeholder approach to generate partnerships and the financing that is urgently needed to achieve our goal. I look forward to working with member states, the WHO, and partners in civil society and the private sector to ensure an open and transparent process leading up to the high-level meeting. Excellencies, we need to act now to make tuberculosis a disease of the past. We are accountable to the people around. We must tackle tuberculosis and reach the goals we set 2 years ago. Your active engagement in the lead-up to the high-level meeting next year will be critical. And again, I count success not as hosting you in New York, or even gaveling through a declaration. Success is measured by the impact that our meeting and agreement will have on the lives of people infected by or at a risk of tuberculosis. Let us not let them down.
Thank you, President of the United Nations General Assembly for the year 2018. So clearly we got invitation, and we might to work with all our Minister of Foreign Affairs to look at how exactly we work with the presidents for this very important issue, not only for the political declaration, also for the actions in your countries. Now it's my privilege to invite the Director General of WHO, Dr. Tedros Ghebreyesus, to speak on comments and public commitment and also what exactly DG could do to respond to actions and a response to call from member states on the very important issues in the coming EB and the World Assembly next year. So Dr. Tedros, you have the floor. I'm not challenging you, don't worry. Thank you very much.
I'm speaking last, so I took the privilege of coming here to the podium and to address you standing. And I will specifically thank two people, so that's why I wanted to make it in standing also. When you thank, it should be from the heart, and better do it standing. Your Excellency, Dr. Veronika, my dear sister, Minister of Health of the Russian Federation, esteemed WHO regional directors, honorable ministers, colleagues, ladies and gentlemen. First of all, I would like to say congratulations. The declaration that you will adopt shortly is a milestone in the history of tuberculosis. For this to happen, I thank all of you, but especially I would like to thank my sister Veronika for her excellent leadership. Please join me in thanking Dr. Veronika for this success. Thank you. And you have seen her leadership qualities when she presided the last World Health Assembly. Still, she is the president of the Assembly until she gives to the next in May 2018. So thank you so much, my sister. So we will conclude it with a declaration. That's up to her anyway. But the second person I would like to thank is the President of the General Assembly, His Excellency, Mr. Miroslav Lajcak. You have already heard his commitment. So we're on our way to make this declaration even more visible and with concrete actions next September 2018. And I thank him for his commitment and the words you have heard from him. It's really incredible. So with this kind of commitment, I think the next 2018 summit on TB, I'm sure will be a success. So please join me in thanking the President of the General Assembly. It is a testament, so there is already the bridge now. You can see the bridge. It's a testament to the power of partnership. What I just said. I know it has not always been smooth or easy, but meaningful change is rarely smooth or easy. You have made significant commitments to scale up services to reduce TB deaths by 90% and TB cases by 80% by 2030. To mobilize domestic financing to strengthen your health systems and reach universal health coverage for your people. To ramp up your investments in research and innovation. And you have undertaken to keep yourselves accountable. These are bold promises. You have also called on WHO to play our part. You have asked us to support the hardest hit countries in their national emergency responses. You have asked us to provide strategic and technical leadership. You have asked us to develop a global strategy for TB research. And you have asked us to work with our member states and civil society partners to develop the accountability framework to which we will all be held. Today, I give you my promise on behalf of all my colleagues here, the regional directors, that we will keep our end of the bargain. We will follow through. As you know, we're working to transform WHO into an organization that's focused on results and impact. And the results you have asked us for are exactly the kinds of results we must deliver. We have already committed to providing an update on progress to our executive board in January and to the World Health Assembly in May. Ladies and gentlemen, as I said yesterday, we stand at crossroads in the history of this ancient disease. When we gather in New York in less than a year's time, what will have changed? What will we have done? Will we be able to say that we have made concrete progress? Will we have expanded services for prevention, diagnosis, and treatment? Will we have mobilized financing? Will we have increased investments in research and development? Or will we have simply written more documents and held more meetings? When the final history of tuberculosis is written, will it say that this moment was a decisive turning point, the beginning of the end? Or will it say it was a wasted opportunity? For the first time, we have the one key ingredient that's essential for success: political commitment. Now, we must build on that commitment with robust science, reliable data, disruptive innovation, relentless advocacy, and dogged determination. We must celebrate successes and learn quickly from mistakes. Progress must be driven from the grassroots up. You have heard the voices of TB survivors. You have heard the voices of the civil society. It's only by empowering the communities most affected by TB that we can truly make progress. It won't happen in Geneva or New York. It will only happen when we give voice to those who have none and support to those who are left behind. We must have the courage of our convictions, but the humility to know that we can only advance by working hand in hand together. I know it's the hardest way. It's the best way, but it's the only way. I thank you. Spasiba balshoi. Thank you very much. Thank you.
Thank you, Dr. Tedros. Thank you very much. And thank all the speakers from WHO Regional Office and Headquarters for your strong commitment and plan to work with member states and support the partnership on different polling issues and taking the issue forward to the United Nations General Assembly in New York. I'm going to invite all the speakers from regional office to take the floor. And I may invite Dr. Tedros and the Minister for Health of Russia to remain on the stage. We're going to move to the next session. Thank you very much to all the region directors. Yeah. Don't forget your mic. Don't forget your mic. Okay, probably it will be the most important, exciting moment. I'm going to invite Minister of Russia Federation, Dr. Veronika, to present the Moscow Declaration for endorsement. Please, Minister.
Глубоко уважаемый генеральный директор Всемирной организации здравоохранения, доктор Тедрос, Ваше Превосходительство, господа министры, глубоко уважаемые коллеги и друзья, мы подошли к кульминационному моменту первой глобальной министерской конференции по туберкулезу. Сегодня, после прошедших обсуждений и проработки, лидеры глобального, регионального и странового здравоохранения, всех заинтересованных секторов экономики и социальной сферы, при широкой поддержке гражданского, пациентского и профессионального сообществ, международных организаций, политиков и дипломатов, словом, всех заинтересованных сторон, заявляют о готовности проявить решимость и единство и активизировать наши действия, направленные на ликвидацию туберкулеза, а также выступить в роли проводников этой идеологии как в другие сектора, области и государственные институты, так и на высокий политический уровень лидеров стран и Организации Объединенных Наций. То, что сегодня глобальный форум по туберкулезу в Москве собрал более 1000 представителей из стран-членов ВОЗ, более 80 министров, послов, руководителей международных организаций, системы Организации Объединенных Наций, неправительственные организации, гражданское общество, пациентские и профессиональные объединения, подтверждает нашу высокую готовность к совместным действиям. В соответствии с меморандумом о взаимопонимании по подготовке к конференции были сформированы руководящие организационные комитеты и секретариат конференции. В работе руководящего комитета приняли участие министры здравоохранения Бразилии, Индии, Китая, Южной Африки, Индонезии, Пакистана, Республики Беларусь. В качестве наблюдателей представители Японии, Соединенных Штатов Америки, Вьетнама и Нидерландов. К работе активно привлекались представители экспертного сообщества из разных стран мира и организаций-партнеров ВОЗ. В формате широкой дискуссии были сформулированы основные цели, задачи и концепция первой глобальной министерской конференции по туберкулезу и подготовлен проект декларации, получивший название «Московской декларации». Проект декларации прошел через 4 этапа межправительственных консультаций с миссиями стран в Женеве, был размещен для обсуждения на официальном сайте ВОЗ, рассматривался и неоднократно дорабатывался в соответствии с предложениями стран по итогам заседаний Высшего стратегического консультационного совета по туберкулезу при генеральном директоре ВОЗ, консультации с руководителями национальных противотуберкулезных программ, региональных офисов ВОЗ в рамках глобального ежегодного саммита, а также на совещаниях высших должностных лиц и министров здравоохранения стран БРИКС. Необходимо отметить большую заинтересованность и активность стран в подготовке документа. Предложения и комментарии направили более 100 стран, 13 международных неправительственных организаций и партнерств, региональное бюро ВОЗ, а также более 50 ведущих экспертов в области туберкулеза. Все они были самым тщательным образом рассмотрены и учтены при доработке декларации. В целом, предстоящая конференция, ее идеология, цели и задачи, проект итоговой декларации более года активно обсуждались со всеми заинтересованными сторонами и странами и получили поддержку на более чем 20 крупных международных форумах и площадках по всему миру, в том числе на таких, как встречи глав государств и министров здравоохранения стран БРИКС, АТЭС, G20, заседания Генеральной Ассамблеи ООН, ВАС, исполкома и региональных комитетов ВОЗ, Высшего экспертного совета ВОЗ, специальных совещаний с партнерскими организациями и заседания Global TB. Последний раунд межправительственных консультаций состоялся 27 сентября 2017 года. Хочется еще раз отметить царившую на полях всех этих обсуждений атмосферу живого и заинтересованного диалога, порой дискуссии с умением выслушать и признать альтернативную точку зрения. Итогом явилось принятие согласованного решения. Уважаемые коллеги, позвольте поделиться еще одной важной информацией. Накануне глобальной министерской конференции 15 ноября 2017 года в Москве завершилась международная научно-практическая конференция «Междисциплинарный подход в решении проблемы туберкулеза» с участием российских и международных организаций и экспертов, специалистов и представителей гражданского общества. Приняли участие в этой конференции более 1000 человек. Мне поручено передать их обращение к участникам первой глобальной министерской конференции ВОЗ «Ликвидировать туберкулез в эпоху реализации целей устойчивого развития. Многосекторальный подход», в котором, в частности, говорится: мы считаем, что для достижения целей, поставленных стратегией ВОЗ NTB Strategy к 2030 году, необходимо обеспечить стабильное и достаточное финансирование национальных программ борьбы с туберкулезом, мобилизовать национальные системы здравоохранения в странах с высоким бременем туберкулеза для выполнения задач по искоренению туберкулеза и обеспечить эффективное межсекторальное взаимодействие по вопросам борьбы с туберкулезом, активизировать международную поддержку проектам по борьбе с туберкулезом в странах с низким уровнем доходов населения и дефицитом бюджета, интенсифицировать научные исследования, разработки и клинические испытания по направлениям, способным обеспечить прорыв в диагностике и лечении туберкулеза, особенно туберкулеза с множественной и широкой устойчивостью возбудителя и коинфекции туберкулеза и ВИЧ, призвать правительства и законодательные органы стран к созданию условий наибольшего благоприятствования для ускоренной регистрации и внедрения новых рекомендованных ВОЗ методов медицинского оборудования и лекарств для диагностики и лечения туберкулеза. Мы с удовлетворением отмечаем, что все насущные требования и предложения стран и широкой общественности, вовлеченной в проблемы туберкулеза, отражены в итоговом документе первой глобальной министерской конференции ВОЗ и поддерживаем Московскую декларацию. Считаем, что она должна быть одобрена соответствующими резолюциями ВОЗ, а ее основные положения положены в основу резолюции предстоящего заседания высокого уровня Генеральной Ассамблеи ООН в 2018 году и, в свою очередь, поддержаны лидерами стран. Только так, выступив единым фронтом, мы можем покончить с туберкулезом в мире. Дорогие друзья, позвольте поблагодарить всех за проделанную огромную работу. Позвольте выразить признательность Всемирной организации здравоохранения и ее руководителю, глубоко уважаемому доктору Тедросу, за лидерство и сотрудничество, за амбициозность и последовательность на пути решения важнейших задач глобального здравоохранения. Проект декларации представлен вашему вниманию. Позвольте поблагодарить всех за единодушную поддержку и объявить о принятии декларации. Спасибо. Дорогие друзья, представители 3 стран выразили желание выступить в связи с принятием декларации. Разрешите последовательно предоставить им слово. Первое слово предоставляется Соединенным Штатам Америки. Пожалуйста. Микрофон включите, пожалуйста.
Could you please switch on the mic?
Thank you, Madam Minister. The U.S. delegation wishes to thank the Russian Federation as the host and the World Health Organization as the organizers of this meeting. We applaud the commitment of the participants at this meeting to overcome the challenges of tuberculosis worldwide. The U.S. sees tuberculosis, particularly MDR-TB, as a major public health concern at both domestic and international levels. As the largest funder of TB research and control efforts worldwide, the U.S. is committed to continuing its strong support for global efforts in TB detection, research, prevention, diagnosis, and treatment. The United States shares many of the goals expressed in the Moscow Declaration and therefore joins consensus in its adoption. However, the document does not reflect the entire position of the U.S. government, and thus we'd like to offer the following few clarifications. The U.S. strongly supports the proposed development of a multisectoral accountability framework, but we wish to stress that such a framework would only achieve its desired purpose if developed in consultation with member states of the World Health Organization and the United Nations and endorsed through appropriate oversight and governance mechanisms. We look forward to re-engaging on this topic and comprehensive discussion of its elements at governing body meetings of WHO and the UN. We also wish to emphasize that our understanding of universal health coverage, as described in the Declaration, reflects the aspiration of improving access to health through each country's individual path towards nationally determined goals. The U.S. government shares the aspiration of increasing access to health care, and we believe countries should do so by reducing costs and expanding health care choices. We applaud efforts to encourage universal health access, but in line with previous UN resolutions, we understand that each country would develop a system within its own cultural, economic, political, and structural context and priorities. Universal health coverage often is interpreted as supporting mostly government-centric solutions and mandates, which the U.S. government does not support. Instead, we recognize the necessary role of partnerships with the private sector and other non-governmental stakeholders in achieving universal access to health care. In conclusion, we would like to reaffirm our support for the Declaration and for the goal of ending TB as a public health menace worldwide, and look forward to substantial next steps on that path. Thank you for your attention.
Спасибо большое Соединенным Штатам Америки. Слово предоставляется Канаде.
Now the floor is given to Canada, please.
Thank you very much. We would like to also thank the World Health Organization for helping to organize this meeting, and we are thankful and grateful to the Russian Federation for having hosted this important meeting, for having facilitated consultations in Geneva. Eliminating tuberculosis is a commitment we've all endorsed under the Sustainable Development Goals, and Canada remains committed to do so. As this meeting has emphatically shown, we are pleased to see so many ready to ramp up efforts to eliminate tuberculosis. Therefore, moving forward, Canada is pleased to join others in support for the Moscow Declaration. We are particularly pleased to see gender inequalities being recognized as an important factor to address if we are to improve our response. We would also like to point out and thank civil society for their continued leadership. Canada will continue to work in close partnership with civil society, and in particular with those who are living with active disease, as well as those at risk of infection, so as to ensure our collective response is informed by the realities of those most affected. We have a unique opportunity next year with the United Nations high-level meeting to secure high-level political commitment for the fight against tuberculosis. And nowhere will this support be more critical than on accountability. An accountability framework would be a concrete and effective deliverable at the United Nations high-level meeting for the political leaders to support, because it is a cost-effective solution to achieve better results with existing knowledge and resources. Canada looks forward to working with others to ensure that a proposal for a multi-sectoral accountability framework is brought forward for consideration at the United Nations high-level meeting next year. A framework that is based on a collaborative and constructive approach will ensure that evidence and resources are better used to guide action and decisions at country level. Thank you very much.
Спасибо, Канада. И слово предоставляется Южной Африканской Республике.
South African Republic, please.
Thank you, Chairperson, and Minister of Health for the Russian Federation, South Africa, in its capacity as the chair of Southern African Development Community, SADC, and also as mandated by the African Union to be its representative, supports and endorses the Moscow Declaration to end TB to be adopted at the first WHO Global Ministerial Conference on Ending TB in the Sustainable Development Era, a multisectoral response, on the 17th November 2017 in Moscow. The declaration, with its clear focus on 4 key topics and its ambitious commitment and calls for action, is inspiring, future-orientated, and actionable to significantly strengthen the response needed to end TB. African states, which carry a disproportionate burden of TB, consider TB as a very serious global health threat. We sincerely hope that the adoption of the Moscow Declaration to end TB will provide the necessary impetus needed to ensure progress against this epidemic. By adopting the declaration, the African Union fully subscribes to the set of concrete objectives that seeks to elevate and sustain the fight against TB at the highest political level, to be led by heads of states and government. Its stated outcomes, in particular, the proposed multisectoral accountability framework, are very much in alignment with the multisectoral action and rationale of the Sustainable Development Goals. We commit to the declaration's innovative and forward-thinking steps that will end TB in our lifetime. We salute the commitment of all partners who have already expressed support for this important goal, including Canada and USA, as we have just heard. This conference is the first of the envisaged milestones on the path ahead, and its declaration should guide discussion at the next World Health Assembly and the United Nations General Assembly high-level meeting on TB in 2018. We are committed to engage in the development of the multi-sectoral accountability framework, which will be taken forward both to the World Health Assembly and the United Nations General Assembly high-level meeting on TB in 2018. Thank you.
Спасибо большое, Южноафриканская Республика. Уважаемые коллеги, все выступления, представленные сейчас, будут опубликованы на сайте Всемирной организации здравоохранения. Спасибо еще раз всем присутствующим, всем странам-членам Всемирной организации здравоохранения. Россия счастлива и благодарит вас за то, что вы доверили нам провести столь важное международное мероприятие у нас в стране. Спасибо большое.
Thank you very much. It's such a great honor and a privilege to witness the endorsement of Moscow Declaration of this important conference. Now I'm going to call for the Mario, Director of the Global TB Program from WHO Headquarters, and Dr. Carissa from the Minister of Health, Russia Federation, to be on the stage for the last very important closing ceremony. Mario.
Dear colleagues, we have now reached the close of our conference. This has been a powerful experience of partnership and commitment in our journey to end TB. Sometimes it was not easy, but we were inspired. Our difficulties is nothing in compare with those difficulties and suffers of millions of people with TB. And we must know that we can do more. We must do more, and we commit to do more.
Yes, I agree. It's a journey and a marathon at that. I always like to say that ending TB is a marathon. This is not a 100 meters rush. We need to get the right pace. We need to persevere without stopping until the end. Now that we have adopted the declaration, we invite you to join us in a special ceremony to demonstrate our commitment to end TB. I would now like to invite Dr. Skvortsova and Dr. Tedros to come forward.
Hello. Come up. Come up here. You must give it
Спасибо.
to the minister. Special flower for you. Make a photo. Welcome.
The World Health Organization commit to end TB.
Yes.
Please come up to the stage and put on your flags as a sign of the commitment to ending TB. You will be the first.
You can go. Yeah.
I'll help you. We have a dream to end TB. Let's join together to make this a reality.
And the future of our children depends on our actions today.
To commemorate this, we have beautiful flowers made by children with TB. These white chamomiles symbolize in Russia free of TB. We present this to you with open heart, dear ministers, as a sign of our joint commitment to wipe out this deadly disease.
We now invite the country delegates and other agency delegates to kindly take your flag, which is in your table, and hand it to these children and our volunteers as you receive the TB flower. The children and the volunteer will then come and place it on the sign on your behalf. Let us start with the delegates from the African, the American, and the Eastern Mediterranean regions. We invite you to accept the flowers and present your flags as a sign of your commitment to end TB. Thank you.
We invite you, the delegates from European, Southeast Asian, and Western Pacific regions. Join us, please. You must take your seat. You can sit.
Never give up, always be strong. Never give up, you're not alone.
You can take your seat.
You have to fight, 'cause at the end of the time, you'll see the light. Living today is very hard. Problems and griefs, there's nothing right. Don't lose your dream, I know it's hard. Believe in yourself, believe in God. People, stand up and leave. Life will go on, you'll see. Never give up, always be strong. Never give up, you're not alone. Don't lose your hope, you have to fight. 'Cause at the end of the tunnel, you will see the light. This is the time when nobody knows what will happen tomorrow, what will happen today. kindness and love will show you the way. People, stand up and leave. Life will go on, you'll see. Never give up, always be strong. Never give up, you're not alone. Don't lose your hope, you have to fight. 'Cause at the end of the tunnel, you will see the light. Bishop. Forget this gloomy day. Together we will find a way. Never give up. Always be strong. Never give up. You're not alone. Don't lose your hope. You have to fight. 'Cause at the end of the tunnel, you will see the light. Never give up. Always be strong. Never give up. 'Cause you're not alone. Don't lose your hope. You have to fight. 'Cause at the end of the tunnel, you will see the light. And with us, never give up. Always be strong. Never give up. 'Cause you're not alone. Don't lose your hope. You have to fight. 'Cause at the end of the tunnel, you will see the light. 'Cause at the end of the tunnel, you will see the light.
Wonderful.
'Cause at the end of the tunnel, you will see the light.
Thank you. Thank you very much. Can you increase the volume, please? The volume. So I ask you to raise your flower, or some of you have flags, I think. This is a sign of commitment to end TB. So you're now committing by raising and waving the flowers you have at hand and the flags. And we will not give up until we end the suffering and deaths due to TB. TB, do you agree?
Yes.
We will end TB.
TB.
We will end TB.
TB.
I can't hear you. You don't seem to be serious. I can't hear you. We will end TB.
We
will end TB.
Yeah.
End TB.
Yeah.
Thank you so much. Thank you for your commitment. Together we will do it. Spasiba большое. Merci beaucoup. Muchas gracias. Asante sana. Vielen Dank.
Thank you.
Thank you. አመሰግናለሁ. Grazie mille. Tak ska du ha. Tak ska du ha. Shishi. Arigato gozaimasu. Shall I continue? Thank you. Thank you very much. Tashakure. Thank you. Shukran. Shukran jazilan. Thank you. Thank you.
Thank you.
Very good.
Honorable delegates. Honorable delegates. Honorable delegates, ladies and gentlemen, may I have your attention, please? I have two important announcements before you leave this room. The first announcement is about the high-level photo. Honorable ministers, I insist only honorable ministers, are invited to join the high-level photo. Please follow the volunteers who are currently waiting for you outside the room. They will take you to the high-level photo location. The second announcement is for all delegates. You are all kindly invited by the Russian Federation to visit the Tretyakov Gallery. For those of you who wish to be part of this excursion, buses will be made available and are currently waiting at the entrance 4 of the venue on the first floor. Thank you for your attention, and I wish you a safe trip back home.
Where do we have to go?